All right, so we also actually doing videos on different concepts that you guys will actually come across as we continue this discussing topics on anatomical pathology. So we are basically looking at like some words in anatomical pathology that we are what prone to be using. Okay, some words that we are prone to be using in anatomical pathology. All right, and one of these words is what they call adaptation. Okay, so now in this video we'll be trying as much as possible to simplify the concept of adaptation in relation to what anatomical pathology. Okay, so now going now to talk about the concept of adaptation. So basically, these are the different types of neoplastic changes that we have, all right? And neoplastic change is basically, okay, there's a stress on a cell, there's a change in the normal way of life that the cell used to experience, and there's now a stress on the cell. The cell will actually tend to actually what? Try to resist the change a bit. Do you understand? And this is what we call adaptation. And in adapting, the cell will have to like, okay, there's a change in the normal way of life, so I'm going to change my way of life, okay, so that I can suit into the new change, okay. So there are different responses that the cell actually performs in order to adapt to the new environment or new stress, okay. And that's the basis of what we'll be looking at when talking about the concept of adaptation as related to what anatomical pathology. So first of all, guys, we said that adaptation is a reversible metabolic, functional, or structural response of cells to changes in the environment. Okay, so there's a reversible metabolic, functional, or structural response, okay, to cells. This is because the normal way of life has changed. So the cell is trying to fit into the normal way of life. Okay, so adaptation allows the cell to survive and continue to function in the presence of stress factors. So, like for example, you see me right now, I'm just coming from class, okay? And this is 11:34 a.m. I have lectures I still have practicals by 2 o'clock in the afternoon, and I have to record like 20 videos before I go to the practice class. Do you understand? That's adaptation. So, in as much as school is stressful, I'm trying to still keep up with my work because there's a legacy I need to keep up with. Do you understand? So adaptation allows the cell to survive and continue to function in the presence of stress. Okay, so there are different responses that the cell actually is not that the cell is not actually doing all of them at once. Okay, we just looking at the types of responses. Okay, that the cell will actually try to adapt. Okay, so now for example, we have hypertrophy. And what is hypertrophy from this image? Hypertrophy is basically, okay, you have four cells and the four cells are increasing in size. Okay, hypertrophy, four cells, that's the size increasing in size, the cell increasing in size. Okay, then we have hyperplasia. What is hyperplasia? Hyperplasia is basically the number of cells are increasing. Okay, so instead of the normal cell being four, the cell is now what? Six in number. Okay, and that's what we call hyperplasia. We have atrophy. Atrophy is basically the cell reducing in size. Do you understand? So it could be that, okay, something is compressing the cell and the cell has to adapt by reducing in size. Do you understand? That's atrophy. Then metaplasia. Metaplasia is basically, I see these cells, would I say they are smooth cornered, okay? But now from smooth cornered, they are now round shaped, okay? These cells are now round shaped, okay? So these are the various responses, these are the various adaptive responses that we have, okay? So this is it. If a normal cell is in the homeostatic state, and there is a stress or increased demand, okay, if it is just a normal stress or increased demand, there could be adaptation, okay. And if there's inability to adapt, then there will be cell death or cell injury, okay. Then looking at this, if there's an injurious stimulus, this is not a stress demand, it's literally an injury, okay. So an injury, cells usually cannot really adapt to injuries, okay, and injuries usually result to what? Cell death. Okay, so guys, this is understanding the concept of adaptation in anatomical pathology, right? So I hope you guys have made a lot of sense out of it. I'll be seeing you guys in the next one. Bye for now.